Grow your eyebrows with your own blood. Joining us now is board-certified dermatologist Dr. William Schweitzer and his patients Elkie and Anna. Do you all want to see their results? I know I'm anxious, so let's see Elkie's before and after first. Wow. Very impressive. And we have Anna's before and afters as well for you all to see side by side. First things first, before we even talk about this medically, I want to ask the two of you if you're happy.
Very happy. Extremely.
I'm very happy as well, yes.
You can't fake those smiles, right?
No.
And I love this. We've talked so much about PRP, and obviously it's being used all over the human body. I didn't think about it for this, but what can people expect if they use PRP to try to regrow their eyebrows?
PRP has a capacity to wake up dormant hair follicles, make them grow again.
Did you start using it in the hair first and then said, why not try the
Yes,
eyebrow?
in fact, about 1.5 years ago, I had a patient that I was injecting their scalp and I had a little bit of PRP left. And I said, do you mind if I inject your eyebrows? They had a bald spot on one eyebrow and the tails of the eyebrow on both sides were thinning. And this is a woman in her early 30s. She said, go ahead. I injected it, and within about a month or 6 weeks, she had tremendous improvement in the area. Bald spot went away, the tails of the eyebrows thickened dramatically.
And when you do this, are you looking at a fairly permanent result once you awaken those dormant hair follicles, or is this something you have to do continuously over time?
Good question. The PRP, the first set of injections tends to grow the hair within possibly 2 months or so. Then we don't know how long it'll last for. Probably in the 9-month to a year period, we would do a booster injection just to keep things active.
And I want to talk a little bit about PRP. You have to be very careful with the PRP you're using and who you're going to get something like this done, right? And I'm asking both of you, both as dermatologists who use this,
And I use
Dr.
it as
Ordon
well,
uses it
yes.
as well, because that would be my fears. If someone just starts, they draw your blood out and they just start injecting it everywhere, that would seem worrisome to me.
Well, so the idea is there are different types of kits you buy that use different chemical reagents to concentrate out the growth factors, and that's what's varies. So you don't want to just go somewhere fly by night where they're drawing your blood and just injecting it right back into you, because then all you'll get is a bruise. You really want those concentrated growth factors.
So is it something that, in particular clinics like yourself, you're preparing this blood just right to get the exact PRP that you want to use?
Exactly. There's what's considered high-density PRP, high-grade, very concentrated material, and then there's cheaper systems that are much lower concentration of platelets, growth factors, and stem cells.
But how do I know if I'm a consumer and I want something like this? How do I have any
I think
idea?
you know you're going to someone who's doing it on a regular basis, that if we're offering it, we're doing it, we want the results.
Absolutely, and I think one of the other things is that you shouldn't go to someone who's over-promising. One of the things, I love PRP. I inject platelet-rich plasma for wrinkles and for hair loss, and now I'll probably do it for brows as well. But one thing to know is that it doesn't treat hair loss of any type. So if your brows are thinning because your thyroid is low, or because you're anemic, or you have some other medical reason, then PRP is probably not going to be the right choice, and those medical conditions have to be fixed first. I think it works beautifully for age-related hair loss, as in this case, but it's not a one-size-fits-all.
And I think Dr. Schweitzer made it very clear that we're trying to kickstart dormant cells. Those cells have to be in a dormant phase and not gone completely, and that holds true for things in the face. If you're using it for orthopedic surgery, things like that too. Well, if you don't have the tissue that's the right kind of tissue to react to it, it's not going to work.
So it's not going to work in everyone. Elkie, Anna, obviously you're very happy. How long till you notice some of these hair follicles doing their thing?
About 10 weeks. 10 weeks was what I was told, so I would check it. And I don't know, it was so gradual that I wasn't sure, is it really coming back, or is it I'm doing a better job at, coloring them or something? But after a while, now I've found myself leaving the house without any eyebrow pencil on, which is something I haven't done in years. So that's huge. Yeah.
Well, I certainly have to say, from a physician's perspective who doesn't do cosmetic procedures, I love the idea of doing a procedure using your own body's plasma. It's a brilliant concept, certainly wonderful for the two of you. Before we go, Dr. Schweitzer, how much does something like this cost?
It's approximately $900 for a session. And then in about 9 months to a year, we would do a touch-up session just to keep things going.
Okay, so I will be in, how's 8 a.m. tomorrow sound?
I will be there.
Dr. Schweitzer, thanks so much. Ladies, you look fabulous. Thanks for joining us. We're putting more things to the test when we return.